Hello and welcome to my channel. In this lecture we will start talking about the mastication process. So let's begin. Mastication is a process that includes two functions, incision and mastication proper. The incision is biting of a piece from a chunk of food, and mastication is grinding this piece into smaller pieces and mixing it with saliva to be easily digested. Mastication is often used to cover both actions. Now, the position of the teeth in relation to each other is called the dental occlusion. The first thing to examine is the arch of the dental arch. The upper dental arch is bigger in width than if compared to the lower arch. This is known as anisognathy. So anisognathy means that the arches of the arch of the upper dental arch is wider than the arch of the lower dental arch. The maxillary molars overhang the mandibular teeth by half a cusp, as you can see here. Buccal cusps of the lower molar and premolars occlude between the buccal and palatal cusps of the maxillary teeth. Now also observe the longitudinal axis of the maxillary molars that incline buccally, while the longitudinal axis of the corresponding longitudinal axis of the mandibular teeth incline lingually. So this inclines buccally, this inclines lingually, resulting in anisognathy and the cusps in relation to each other. This is called dental occlusion. Now, chewing occurs only at one side at a time because of anisognathy that we described before. And due to this, the maxillary anterior teeth, as you can see here, also going to protrude in front of the mandibular anterior teeth. This is called an overjet, positive overjet. If the mandibular teeth are in front of the maxillary, this is called negative overjet, but this is positive overjet, in which the maxillary incisors overhang the mandibular incisors by about 2 to 3 millimeters in the horizontal plane. Now, at rest, the mouth is closed by tonic contraction of the muscles of mastication and facial expression we studied before in the head and neck. And the teeth are not in contact at rest, but separated by 2 to 4 millimeters gap. This is called the intercuspal space. The whole position is called the mandibular or posture rest position. For simplicity, it's called the rest position. Now, when the gap between the teeth is closed and they are in maximal contact, this is called intercuspal occlusion. Now, to classify the occlusion, the most common used classification is Angel's classification, by looking at the relationship of the first permanent molars and the first permanent molar teeth to erupt. They are the first to erupt and guide the other permanent teeth into position. Angel's classification 1, or Angel's class 1, or the normal occlusion, as you can see here, this is the normal occlusion. Look at the permanent molars here. The mesial cusps, those cusps, the mesial cusps of the upper first permanent molar occlude in the groove between the mesial and distal cusps of the lower permanent teeth, as you can see here. The mesial cusp of the upper between the mesial and distal of the lower. So there will be the same relationship between the second and third molars posteriorly. Each mandibular tooth anterior to the first molars will be mesial to its maxillary equivalent. Angel's class 2 occlusion. The buccal cusps of the first maxillary molar occlude between the distal surface of the lower second premolar and the mesial cusps of the first molar, as you can see here. Okay, so slightly anterior, slightly forwards. The upper jaw is slightly forwards, as you can see here. It's evident here. The whole mandibular dentition is further back than in class 1. This is called distocclusion. The consequence of on the anterior teeth, the upper anterior teeth have a pronounced overjet or extremely positive overjet. Angel's classification 3 occlusion or class 3 occlusion is when the lower molars are more forward than the upper dentition actually. So here you can see that the mandibular teeth in a state of negative overjet, I mean forward, more forward than the maxillary incisors. The whole mandibular dentition is echeloned further forwards, echeloned like formation of the army, than in a class 1, giving the alternative name of mesioocclusion. Mesioocclusion. This is Angel class 3 occlusion. Now, to study the mandibular movements during chewing activities, it varies between individuals. As we stated before, it starts by incision and then grinding of the smaller portions of food. Incision, of course, takes place at the front teeth or the anterior teeth, while mastication, the rest of the process of mastication, takes place at the posterior teeth. Incision. The movements of the mandible during incision, the mandible must be depressed, of course, to open the mouth, to accommodate the food and protrude it forward enough so that the incisor teeth will come into edge-to-edge contact when the mouth is closed. Now, for the muscles acting in this cycle, the lateral pterygoid muscles on both sides initiate sliding movements of the mandible. Then the suprahyoid muscles act to produce depression of the mandible, and of course, as you studied before in the neck, the suprahyoid muscles are supported or fixed down by the infrahyoid muscles. The lateral pterygoids continue to protrude the mandible so that the incisal edges of the lower incisor teeth are positioned below the corresponding surfaces of the upper incisors. Then, after opening the mouth, the mandible is then elevated to cut the chunk of food. The medial pterygoid muscles initiate elevations and then followed by temporalis and masseter muscles that quickly become active. Now the incisors cut through the food and the mandible is then retracted by the action of the horizontal fibers of the temporalis muscle, so that the edges of the lower incisors slide upwards across the palatal surface of the upper incisors. Also, the tongue transfers the portion of the food to the posterior teeth on one side or the other. Now, mastication begins. Each mastication composed of a series of masticatory cycles. The cycle consists of an opening stroke in which the mandible is lowered and moved laterally to the working side. Food is then positioned between the teeth by the action of the tongue and cheeks. The mandible is elevated in the closing stroke by the lateral excursion to the working side is maintained. In the final stages of elevation, the mandible is moved backwards towards the midline, so that the occlusal surface of the lower teeth glide medially close to the corresponding surfaces of the upper teeth. The late phase of closing the mouth is often referred to as the power stroke. Powerful isometric contraction of the jaw muscles, elevating muscles, keeps the teeth closely approximated so that food is ground between the opposite occlusal surfaces. Here you can notice the action of lateral pterygoid and temporalis. Now, due to anisognathy, the masticatory cycle is unilateral. We said we can chew only on one side. In some individuals, the whole masticatory sequence takes place on one side. In other individuals, the food is switched in rapid, often irregular succession between the two sides. The duration of each masticatory cycle varies from about half a second to just under 1 second, with the power stroke occupying approximately 1/4 of the total time. Some individuals masticate on one side, but if chewing becomes unilateral, a problem should be suspected. During a masticatory cycle, muscle activities combine in a complex manner, as we will see now. Now, in the opening stroke, the two lateral pterygoid muscles are active, but the balancing side muscles predominate, so that the mandible is swung laterally towards the working side. The working side means the chewing side. And the horizontal fibers of temporalis of the working side prevent the condyle from sliding forward. This produces side-to-side movement of the mandible called the Bennett movement. We'll get to it later. The digastric and the mylohyoid muscles are also active during the opening stroke, as we studied before. They work off the hyoid bone, which is fixed by the infrahyoid muscles, and then the medial pterygoid muscles initiate closing. Now, the sideways movements of the mandible is mainly enforced by the lateral pterygoid muscle. It runs, as we studied before, from the neck of the mandible to the lateral wing or lateral plate of the sphenoid bone. The mandible is moved to the side as a whole by the musculature responsible for mastication. This lateral movement of the whole mandible is known as the Bennett movement, as you can see here. The sideways shift is generally no greater than 2 millimeters. Bennett movement is measured between the resting position and the displacement after a completed lateral movement of the mandible. This is called the Bennett movement. Now, the masseter muscles, they have a similar differential activity between the two sides, and although their activity begins later than the corresponding medial pterygoids, pay attention to this. The temporalis muscle, the degree of activity in the temporalis muscle is about the same on the two sides, and the activity in the jaw closing muscles is greater when tough food is chewed, and least when the food is soft, of course. Activity tends to decrease with successive masticatory cycles as the food is progressively broken down and softened. This was a previous hand about occlusion and mastication. We'll continue talking about mastication in part 2. I hope you got the maximum benefit from this lecture, and thank you very much for watching.